The United States is one of the most innovative countries, but yet we still fall behind in our healthcare. While we are able to receive great treatments for diseases, we fall behind in providing care for all with expensive healthcare services. Even if the individual is insured, they can still face debt with unexpected medical charges. Today, I will discuss systems that other countries have used in different ways in order to prevent expensive burden on citizens. We should implement something like them in order to prevent the burden of debt and early death due to the lack of healthcare access we have. Our healthcare system may seem like it is helping a lot of other people, but in fact, Americans have one of the lowest life expectancies, and compared to other developed nations due to the competition of drug markets and making medications more expensive so poor individuals cannot pay for the services, as well as systems that endorse the number of patients seen and not the outcome of the patients. Prices of medications, operations, and services vary across different geographical locations depending on where you live, but none of this information is listed for the public to see, so it can be surprising when you get like a check and the individual might not know how much to pay, and then they'll end up going into debt because they weren't ready for how much money they had to spend, especially if you don't have insurance. According to Olga Kazan, that works for The Atlantic, she discussed the findings of Commonwealth Fund, which ranks the health systems of countries, found that the U.S. ranks in the lowest for 20 years. In her article posted in 2018, she found 3 reasons for why the U.S. lacks in healthcare. One of those being the lack of insurance coverage because they can't afford it. If the health insurance is too expensive, then individuals will lack and be able to postpone receiving health care, so they will need to stop purchasing medications due to the expenses because they can't afford it. Thomas Grenay discusses the problem of the surprise billing in the United States American Bar Association article posted last year in September. Surprise billing is unexpected costs that individuals receive after medical procedures that are out of insurance coverage. These surprises have been shown to be leading the cause of personal bankruptcies in the U.S. The major expenses in the insurance, as well as those who have coverage but know that certain treatments will not be covered by insurance. The reason there has not been a change to this is the barrier that is keeping the change from happening is that the government has not been set up in the way where they can decide how expensive everything is. It's based on the companies. Most prices are set up by the businesses that want to charge however much they think is worth the services. It would also involve a lot of time and money to implement a policy of that gravity. It would just take a long time to convince everybody to want to do something like that. Our current system, as stated by Thomas Grenay again, is a surprise billing system due to the partnerships insurance companies have with healthcare providers, where they negotiate the price and the care the individual received, reducing the ability of these prices to be known by the public. In order to accomplish this, we need to be more transparent with the healthcare, and the first step, we should be working with the local to state government agencies and petition for more transparent healthcare where everyone can see how much each thing is going to cost and how well it's going to work. Also, the plan would be to meet yearly and set government mandates and set pricings for healthcare in order to provide easy pricing knowledge to the customer and prevent surprise costs and debt. So we'll have like a set amount price for each job, and you can't go over or under a certain amount. And it would take a lot of work, but also meeting with the providers and discussing what their margin is of how much they need to make to not be losing a bunch of money and still be able to keep going. The government would have to meet yearly to discuss the costs and healthcare procedures, and they would have to keep going back and changing year by year if things ended up changing. Providing pricings allow individuals to be known about their medical bills as they should expect in the future so they can be ready. It is also allows individuals to be able to shop for their care and choose what the best options are for them, so they don't have to go for the most expensive thing. They can go for what works best for them in their area. In the UK, where they have placed set pricing for healthcare procedures and pay half of what we Americans do, they have a longer life expectancy and a lower infant mortality, according to T.R. Reid of the PBS documentary with the video being called Sick Around the World, published in 2008. In conclusion, I've discussed why we as the U.S. need to change the way healthcare services are for the better. If we incorporate the ideas of setting medical prices as other countries do, then the medical process and services will be a lot easier, and it will help citizens become healthier and to live longer without the thought of being in debt and not being able to pay off the treatments that they have to have. If needing medical services is not something that you can always control, so why should they have to pay for something an extreme amount where they can't afford it, have to worry about it, if it's not something they can control, going to the doctor and needing healthcare services? Thank you.